Hello, I'm Dr. Helen Brooke, urologist and men's health specialist, and today we're going to talk about something that affects millions of men but is rarely discussed openly: erectile dysfunction, or ED. Now, over my years in practice, I've had countless men come to my office embarrassed, frustrated, and thinking that pills are their only option. They want to know, are there natural ways to improve my erections? Can I fix this without medication? And the answer is absolutely yes. Today, I'm breaking down the top 5 natural, evidence-based methods to improve erectile function that I recommend to my patients every single day. Understanding erectile function, the basics before we dive into the solutions. Let me explain what's actually happening during an erection. Getting and maintaining an erection is actually a complex process that involves your brain, nerves, blood vessels, hormones, and muscles all working together. It starts with sexual arousal, whether that's physical touch, visual stimulation, or just thinking about something sexy. Your brain sends signals down through your spinal cord to the nerves in your penis. These nerve signals cause the smooth muscle in your penile blood vessels to relax, which allows blood to flow into the 2 chambers of erectile tissue called the corpora cavernosa. As these chambers fill with blood, your penis becomes rigid and erect. At the same time, the veins that normally drain blood from the penis get compressed, trapping the blood inside and maintaining the erection. Now, erectile dysfunction happens when there's a breakdown anywhere in this process. It could be psychological, stress, anxiety, depression. It could be vascular, problems with blood flow. It could be neurological, nerve damage from diabetes or surgery. It could be hormonal, low testosterone. Or it could be physical, scar tissue or structural problems. The good news is that many of these underlying causes can be addressed naturally. Method number 1, exercise. The most powerful natural ED treatment, the first and most important thing I tell my patients is exercise is medicine. And when it comes to erectile function, regular physical activity is absolutely the most powerful natural treatment we have. Let me explain why. Erectile dysfunction is often the first sign of cardiovascular disease. Your penis has some of the smallest blood vessels in your body, so when you start developing atherosclerosis, that's plaque buildup in your arteries, your penile arteries are often affected first, sometimes years before you have any heart symptoms. Regular cardiovascular exercise improves blood flow throughout your entire body, including to your penis. It helps lower blood pressure, reduces inflammation, improves cholesterol levels, and helps your blood vessels stay flexible and healthy. Studies show that men who exercise regularly have significantly better erectile function than sedentary men. But here's what's really important. You don't need to become a marathon runner. Even moderate exercise like brisk walking for 30 minutes 4 times a week can make a significant difference. I recommend a combination of cardiovascular exercise, walking, jogging, swimming, cycling, and strength training. The strength training is important because it helps boost testosterone levels naturally. One specific type of exercise I want to highlight is pelvic floor exercises, also known as Kegels. Now, most people think Kegels are just for women, but they're incredibly important for men too. Your pelvic floor muscles help maintain erections by compressing the veins that drain blood from the penis. When these muscles are weak, blood can leak out too easily, making it difficult to maintain an erection. To do a Kegel exercise, tighten your pelvic floor muscles, the same muscles you'd use to stop urinating midstream. Hold for 3 seconds, then relax for 3 seconds. Work up to doing 3 sets of 10 repetitions daily. Studies show that men who do pelvic floor exercises regularly can see significant improvements in their erectile function within just a few months. Method number 2, optimize your diet. You are what you eat. The second natural method is dietary optimization, and this is huge. What you eat directly affects your blood vessels, hormone levels, and overall health. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, fish, nuts, and olive oil, has been shown in multiple studies to improve erectile function. Why does this diet work so well? First, it's rich in antioxidants that help reduce inflammation and protect your blood vessels. Second, it provides healthy fats that your body needs to produce hormones like testosterone. Third, it helps maintain a healthy weight, which is crucial for erectile function. Let me be specific about foods that can help. Dark leafy greens like spinach and kale are rich in nitrates, which your body converts to nitric oxide. Nitric oxide is the key molecule that causes blood vessel relaxation and increased blood flow to the penis. Watermelon contains citrulline, an amino acid that also boosts nitric oxide production. Fatty fish like salmon, mackerel, and sardines provide omega-3 fatty acids that improve blood vessel health and reduce inflammation. Nuts, especially pistachios and walnuts, have been shown in studies to improve erectile function, probably because they're rich in healthy fats and arginine, another amino acid that supports nitric oxide production. Dark chocolate, and I mean real dark chocolate with at least 70% cocoa, contains flavonoids that improve blood flow. Pomegranate juice has been shown in some studies to improve erectile function, likely due to its high antioxidant content. On the flip side, you want to limit foods that can harm erectile function. Processed foods, excessive sugar, and foods high in saturated fat can all contribute to inflammation and blood vessel damage. Excessive alcohol can also impair erectile function both in the short term and long term. Method number 3. Manage stress and prioritize sleep. The third method is stress management and sleep optimization, and this is often overlooked but absolutely critical. Chronic stress and poor sleep can absolutely destroy your erectile function through multiple mechanisms. When you're chronically stressed, your body produces high levels of cortisol, a stress hormone that can suppress testosterone production and interfere with the blood flow mechanisms necessary for erections. Stress also contributes to anxiety, and performance anxiety specifically can create a vicious cycle where worry about erectile function actually makes it worse. Sleep is when your body produces most of your testosterone, typically during deep sleep phases. Men who consistently get less than 6 hours of sleep per night often have significantly lower testosterone levels. Poor sleep also affects your mood, energy levels, and overall health, all of which impact sexual function. I recommend my patients aim for 7 to 9 hours of quality sleep per night. Create a sleep-friendly environment. Cool, dark, and quiet. Avoid screens for at least an hour before bed, as the blue light can interfere with your natural sleep-wake cycle. If you snore heavily or feel tired despite getting adequate sleep, talk to your doctor about sleep apnea, which is common in men with ED. For stress management, find what works for you. This might be meditation, deep breathing exercises, yoga, regular physical activity, spending time in nature, or talking to a therapist. Mindfulness meditation has been specifically studied for erectile dysfunction and shown to be helpful, especially when anxiety is a contributing factor. Method number 4. Quit smoking and limit alcohol. The fourth method is eliminating smoking and limiting alcohol consumption. If you smoke, quitting is one of the most important things you can do for your erectile function. Smoking damages blood vessels throughout your body, including the delicate arteries in your penis. It also reduces nitric oxide production, which is essential for healthy erections. The good news is that quitting smoking can lead to improvements in erectile function relatively quickly. Some men notice improvements within just a few weeks of quitting, as their blood vessel function begins to recover. If you need help quitting, don't try to do it alone. Talk to your doctor about smoking cessation aids like nicotine replacement therapy or prescription medications. As for alcohol, moderate consumption, that's up to 2 drinks per day for men, probably won't harm your erectile function and might even have some cardiovascular benefits. But excessive alcohol consumption can definitely impair erectile function both acutely and chronically. Alcohol is a nervous system depressant that can interfere with the nerve signals necessary for erections, and chronic heavy drinking can lead to hormonal imbalances and blood vessel damage. Method number 5. Maintain a healthy weight and optimize hormones. The fifth and final method is maintaining a healthy weight and optimizing your hormone levels, particularly testosterone. Obesity is strongly linked to erectile dysfunction for several reasons. Excess weight, especially around the midsection, increases inflammation throughout the body and can lead to insulin resistance and diabetes, both of which can damage blood vessels and nerves. Obesity also affects hormone production. Fat tissue produces an enzyme called aromatase that converts testosterone to estrogen. So the more excess fat you carry, especially visceral fat around your organs, the lower your testosterone levels tend to be. Losing even a modest amount of weight, 10 to 15 pounds, can lead to significant improvements in erectile function for overweight men. The combination of improved blood vessel health, reduced inflammation, and better hormone balance can make a dramatic difference. Speaking of hormones, testosterone is crucial for sexual desire and erectile function. While testosterone levels naturally decline with age, they shouldn't plummet. If you're experiencing symptoms like low libido, fatigue, mood changes, or difficulty with erections, it's worth having your testosterone levels checked. Natural ways to optimize testosterone include regular exercise, especially strength training, getting adequate sleep, managing stress, maintaining a healthy weight, and eating a balanced diet with adequate healthy fats. Certain nutrients like vitamin D, zinc, and magnesium are also important for testosterone production. Important considerations, and when to see a doctor now, I want to be clear about something important. While these natural methods are incredibly effective and should be the foundation of any approach to improving erectile function, they're not magic pills. It takes time to see results, typically several weeks to months of consistent lifestyle changes. Also, erectile dysfunction can sometimes be a sign of underlying health conditions like cardiovascular disease, diabetes, or hormonal imbalances that need medical attention. If you're having persistent problems with erections, especially if they came on suddenly, you should definitely see a healthcare provider. You should also see a doctor if you have other symptoms like chest pain, shortness of breath, extreme fatigue, or urinary problems along with erectile dysfunction. These could be signs of more serious underlying conditions. Don't be embarrassed about discussing this with your doctor. Erectile dysfunction is incredibly common, affecting about 30 million men in the United States alone. We're trained to help with these issues, and there are many effective treatments available if lifestyle changes alone aren't sufficient. The bottom line is this: your erectile function is a window into your overall health. The same things that are good for your heart, your blood vessels, your hormones, and your overall well-being are also good for your sexual function. Regular exercise, a healthy diet, adequate sleep, stress management, and avoiding harmful substances like tobacco and excessive alcohol can make a profound difference in your erectile function naturally. These lifestyle changes take time and commitment, but they're incredibly powerful. Unlike pills that you take for a temporary effect, these natural methods address the root causes of erectile dysfunction and improve your overall health at the same time. Remember, you don't have to suffer in silence with erectile dysfunction. It's a medical condition, not a character flaw or something you should be ashamed of. Whether you choose to address it naturally, with medical treatments, or a combination of both, the most important thing is that you take action and prioritize your sexual health. If you found this information helpful, please share it with others who might benefit. Sexual health is an important part of overall health and quality of life, and every man deserves to have the information and tools he needs to maintain healthy erectile function throughout his life. Take care of yourself. You're worth it.